Hi, we're here with Mr. M. It is Friday, November the 28th, the day after Thanksgiving. Much better than doing an abdominal assessment the day of Thanksgiving, as Mr. M is probably well aware of. We didn't have to do any deep palpation, until tonight. So we're going to start with the history. We'll try and make it a little bit quick. Mr. M, are you having any problems with your stomach, your abdomen right now?
No.
Any pain? Any abdominal pain?
No.
Okay. Are you having any nausea?
No.
Vomiting?
No.
Diarrhea?
No.
Acid reflux?
No.
No. Any problems with your bowels in general?
No.
No. Any problems with your bladder?
No.
No. Okay. Have you had a history of any surgeries in your abdomen?
No.
Any malabsorption syndromes?
Nope.
Any congenital syndromes with your stomach? Peptic ulcer disease?
No.
No. How about your family? Any family history of stomach cancer or other digestive ailments?
No.
Any Crohn's, colitis?
No.
No. Okay, so a pretty negative history, and that's good. That's normal. So we're going to inspect. And for the inspection, we got a good source of tangential lighting, so I can see that there's no bulges or masses, no shadows where there shouldn't be one. I'm not seeing any pulsations of the aorta, which would be sort of a positive finding we would not want to see. I can see his breathing is nice and normal. I do not see any scars on his abdomen. I don't see any stretch marks on his abdomen. Venous patterns look normal. His abdominal tone looks approximately normal as well. Now at this point, normally we would have the patient sort of flex their head towards their chest, like a little bit of a crunch, and we would look to see what happens with the abdominal muscles. But Mr. M has some problems with the discs in his neck, so I'm not going to ask him to do that. I am going to kind of take the angle from here. Can you tense your muscles a little bit? Okay, good. So he's got good tone, but I don't see any umbilical hernias or any separation. Like with some of my postpartum patients, I see a diastasis, a splitting of the rectus abdominis muscle. I don't see any of that. Okay, so I'm going to now auscultate. That is the next step. And we do auscultation before we do percussion or palpation because we don't want to start pressing around on all the structures of the abdomen and then listen. We don't know if we're listening to peristaltic waves or if we're listening to all the movement of the stuff we just kind of messed with. So I'm going to listen. The important thing for this assessment is to remember to listen in all four quadrants. I don't think there's any magic to the sequence that I'm going to use, but I always start in the right with the diaphragm. I'm going to go right upper. Listening for clucking, pinging, gurgling should occur every 5 to 35 seconds. A person who has very active vowel sounds that are, really loud, growling, the growling sounds, we call borborygmi. A person who has sluggish or hypoactive bowel sounds needs to be watched carefully and assessed for constipation. Especially your fresh post-ops. If they come back from surgery, it's not uncommon initially for them to have absent bowel sounds or hypoactive, but we really need to get those bowels moving before we send that person home. They can get some long-term complications from the slower moving of the bowels. So, okay, so that auscultation was normal. You can also auscultate with the diaphragm and the bell over the liver and over the spleen for friction rubs. I can do that now. First with the diaphragm, over the liver. I don't hear anything abnormal. Being such a good patient. Okay. And I don't really hear anything abnormal over there. I can also listen with the bell of my stethoscope. Between the umbilicus and the xiphoid process, really, you can listen for the aorta. I'm listening over the renal arteries, over the iliac arteries. I could listen here and here over the femoral arteries, but I'm really not going to hear anything through his clothes, and we're not going to take them off. So what I would be listening for are vascular sounds, especially bruits, which are a sound that indicate turbulent blood flow. If you've never heard a bruit, someday maybe work on a dialysis floor and you will hear bruits that were intentionally created with the arteriovenous fistulas. But in a normal patient who has not had that procedure, a bruit is not a normal finding. We don't really like to hear them. Okay, so all of that auscultation was normal. And we move on to palpation. Start with light palpation. Okay, Mr. M, I know you're ticklish. My hands are cold. So if it bothers you to have me pressing, I know you're fine. You can put your hand on top of my hand. Okay, so I'm palpating only about a centimeter in. I'm not jabbing or going any deeper. And I'm going over all 4 quadrants. You might get some tenderness over the colon, especially when you go deeper for palpation. Okay, I'm not feeling any masses. I'm not feeling any weird pulsations. It all feels just normal abdominal muscle. He's not rigid or board-like. A rigid or board-like abdomen could be a tip-off that you've got some peritonitis or appendicitis going on. I can do some deeper palpation. Okay, and we're going to deeply palpate. Again, I'll have you put your hand there over the entire abdomen. Okay. Again, I'm not seeing, I mean, he's a little bit ticklish, but no board-like rigidity, no real tenderness. There's, sorry, and that's kind of a normal thing too. There's going to be certain spots, especially in the person's colon, where they're a little bit more tender, and he's actually just really ticklish. Okay, so that was our deeper palpation, and we can palpate for the liver borders. You can hook your hands under here. Take a deep breath for me. Okay, when he does that, I can feel the lower edge of the liver, but it's like real deep in there. I don't really want to dig around too much just for the video. Okay, then I'm going to feel for the spleen. Okay, I know. I'm going to feel for the spleen, and I'm going to hope I don't feel it. Splenic enlargement is not, I'm sorry. The splenic enlargement is not a really good sign, so I'm glad that I did not assess that. For the gallbladder, I can go, there's the umbilicus, that's one landmark. ASIS, the anterior superior ischial spine, and I palpate right here, okay? And I'm not getting any tenderness. I don't feel anything really unusual there either. Okay, so that's the gallbladder. We can then look at we'll percuss. Okay, so over all 4 quadrants, you're going to kind of percuss over the intestines. And I'm hearing tympany, that nice drum-like sound that tells me I'm over air. When you're hearing dullness or flatness, you're over something solid. So if you're supposed to be over the liver, that's okay. But if you're somewhere in this general area and you're expecting air and you percuss dullness, and you palpate some masses, that could be something to be concerned about. Okay, so that was percussion over the entire intestine. We can go percuss for the liver border, okay? What we do is we start with the umbilicus in the mid-clavicular line, and I'm still hearing tympany, or the intercostal spaces. Okay, so this is a duller sound right here. And I did make a mark earlier when we did the practice video for this, but I'm going a little lower this time. Now to find the upper border of the liver, I'm going to start at the third 1, 2, 3 intercostal space. You don't want to percuss over the ribs, where I expect to hear resonance. And when that changes to dullness, okay, right. Maybe. Okay, so we're going to go right about there. I was right. Okay. So right about there, we're going to measure. Okay. And 4 to 7 centimeters would be normal. So let's see what we got. We'll start here. And I got 6 this time. I think I got 5.5 last time. So yeah, it's just a difference probably in the way that I percussed. So that's a normal size liver right there. We can percuss over the spleen, or where we expect. About the 10th intercostal space. Feeling. Yeah, and right about there. And that's kind of normal. Um, we would percuss for the gastric bubble, which we would expect to find over the left side, right near the. And do you hear how that's different? And well, maybe you can't hear. I don't know how good the microphone is, but there's a difference in pitch. Over here, the tympani is lower. Over here, over that gastric bubble, it's a little higher pitched. So that's our gastric bubble. Okay, so we're looking at the umbilical ring, palpating, no masses, no tenderness, it's all good. And for the kidneys, to do some deep palpation here. Okay, just kind of like a fish that's flopping. I want you to arch your back a little, not too much. I don't want you to hurt your back. And I'm going to have one hand in the back and one hand trying to capture the kidney. And it's real deep in there, but I can palpate the lower border of the right kidney. Right there. Okay, I'm sorry. Okay, and I'm going to do that again on the left. And again, I don't know if you can see my angle here. But yeah, he's got his back arched very nicely. I'm sorry. And I really can't palpate the lower border of the left kidney as well as I could the right. And he's starting to get a little uncomfortable, so I'm not going to keep going there. Okay, and then I'm feeling for aortic pulsations. And you can put your 2 fingers on the side of where you would expect the aorta to be. And you can sort of palpate for a pulse. And I'm not really feeling anything, which is good. If you've got a real, sometimes you'll see people with pulsations in the abdomen, and that can be a sign of aortic aneurysm. So that's really not a good thing necessarily. And we felt for other masses and did not find anything. My last test, I'm going to have you sit up, and we're going to percuss over your kidneys at the costovertebral angle. I'm actually going to have you sit on the side of the bed over here so that the video can catch what I'm doing. To your back. Okay. Yeah. Now, okay. So I put my hand here at the costovertebral angle. I can actually use this hand and I kind of, and see if I elicit any tenderness there. And no, he's not yelping in pain. Patients who have pyelonephritis or kidney stones, if you do this, they're going to kind of, it will hurt. So we didn't elicit any tenderness. And we've had a pretty good abdominal assessment. Glad we waited until the day after Thanksgiving. Thank you, Mr. M, for being so cooperative.